Hello, this is Dr. Grande. Today I'll be discussing the PTSD definition controversy. Now, PTSD stands for Post-Traumatic Stress Disorder, and there is a controversy over how the Diagnostic and Statistical Manual, the DSM, defines PTSD. Now, there are actually a few areas here where there's controversy. I'm going to be focusing mostly on the qualifying stressor controversy. And this deals with how the DSM defines what stressors qualify as a trauma. So PTSD, in terms of the mental health disorders in the DSM, is unusual in the sense that it's conditional. With other disorders, they are diagnosed based on whether symptoms are present or not. With PTSD, there are symptoms that would need to be present for a diagnosis, but there's also this trauma piece. The trauma has to qualify as an actual traumatic event in the definition of PTSD so that you can move on and look to see if someone qualifies based on the symptoms. So it is a disorder that has a condition, unlike a lot of the disorders in the DSM. Now, it's this condition that causes part of the controversy. So in looking at what qualifies a stressor to be a trauma, you'd have direct exposure to a trauma, that would qualify. You'd have witnessing a traumatic event in person that occurs to other people. A traumatic event occurring to a close friend or family member would qualify, and repeated exposures to trauma-related material. Now, this exception, the repeated exposures exception, so that something does qualify as a trauma, can also be through media like pictures, movies, television, as long as that exposure is work-related. If that repeated measures criterion is not based on work, then it's not met. And that trauma would be a non-qualifying stressor. So it could still be a trauma, it just wouldn't be a trauma that qualifies for a diagnosis of PTSD. And this is the area where there is much of the controversy, as I mentioned. Studies tell us, evidence shows us that divorce, having a close friend imprisoned, having relational problems, having difficulties at work, and many other stressors, which are non-qualifying stressors, lead to many, if not all, the symptoms, in some cases, we see in the definition of post-traumatic stress disorder. So there could be flashbacks, intrusive memories, hypervigilance. All these elements could be present even if a non-qualifying stressor seemed to be causal, or at least occurred first. Just like a qualifying trauma would have to occur first for PTSD. So this becomes an issue of how broad or narrow the definition of post-traumatic stress disorder is. Is it too narrow? Have we restricted the number of people that qualify for PTSD too much? Or is it just right, or is it too broad, or too many people included? And this is just really a matter of how we want to categorize distinct pathologies. So there is no perfect answer here. Normally, when looking at the definition for a disorder, we want those symptoms to be a distinct cluster of symptoms that tend to stay together and are seen together. And post-traumatic stress disorder does seem to qualify at that level, the current definition. But we also don't want it to be too restrictive or broad. So when you think about how this influences treatment, how we define a disorder is important. It does matter. Whether somebody qualifies for PTSD or not could impact how they're treated, how providers are reimbursed, what kind of treatment somebody can receive, like group therapy or not, or specialized individual therapy. There's a lot of factors here. So the definition is important. However, even with what some people consider to be a restrictive definition, we can still treat people for the symptoms of post-traumatic stress disorder without qualifying for the diagnosis, even if they don't qualify for the diagnosis of PTSD. So individually, as a clinician, of course, we're going to do what we need to do within reason to treat people so they can manage symptoms, get rid of symptoms, be productive, whatever their goals are. We don't necessarily need somebody to be in the category of PTSD to line up with that category in terms of symptoms or not. We just need to be able to identify symptoms that would be the focus of treatment and deliver our best treatment. However, as I mentioned, the definition is important, and I think that continued research in this area would be helpful. I hope you found this description of the PTSD definition controversy to be interesting. Thanks for watching.